Disabilities in Kolkata, and a member of the Executive Committee of the Nursing Research Society of India, a very prestigious body and no doubt doing important work there. She's currently conducting some interesting research, I note, into therapies for children on the autism spectrum. A very contentious issue, I would imagine. There are so many different therapies out there, so some of them far more legitimate than others, should we say. Today she's going to give us some insights into this area of autism, looking at her work on parental interventions. Again, an important area, and one which is an area of considerable stress for many parents. I'm looking forward to hearing what she has to say. Just before I hand over to Dr. Mandal, can I remind everybody, please, to switch off your microphones during the session. We don't take questions actually during the presentation, but at the end of the presentation, there will be an opportunity for people to ask questions. There's a facility at the bottom of your screen to raise your hand if you have a question. And if I'm not around, I'm sure Rajesh or Janti will pick up the questions at the end. So once again, thank you everybody for attending. Welcome, Dr. Mandal, and I'm going to hand over now to you. Thank you very much.
Thank you, sir. Thank you so much. I'll just start the screen sharing. Okay. I hope my screen is seeing my slide.
That's yes, perfectly clear. Thank you.
Okay. Thank you so much. And thank you for the good words you told about me. And it's an honor to be here and a good opportunity to share, our activities with you all. I have been participating as an active listener and also in the discussion in the previous webinars. I had tried my best to be in most of it, and they're very interesting and big learning opportunity. So today, I thought I will just tell about the prefix I use, that is Lieutenant Colonel. Those who are not initiated to the Army, I would just like to say that this Lieutenant Colonel is my rank from the Indian Army, where I was working as a military nurse. So that is the Lieutenant Colonel thing. So here we are at the end of 2024, and as Richard sir has just pointed out, we are going forward, we're looking out for the celebration and festivity and stepping into the new year. And if you look at 24, this had been a remarkable year for autism research. There had been so much of progress in screening, in diagnostic tests, using the researches on microbiota and the researches on using immersive technologies and virtual reality for enhancing the communication of ASD children and individuals. So there is so many things happening all around. So the basic question is maybe coming to everyone's mind, that why suddenly a parent-mediated intervention? Of course, the word sudden is not correct. Parent-mediated interventions have been there, existing since a long time, but it's a very basic thing. It is taken for granted. It is obvious. Everybody feels that parents get trained when the child is, undergoing any therapy. So why are we focusing on parent-mediated intervention at this point of time? So in the next few slides, I will try to give you a background and justify our rationale for using and focusing on a parent-mediated intervention. So if you look at autism spectrum disorder, you will find that it is a diverse group of condition, and it is characterized by difficulty in social interaction and communication. The another characteristics of ASD is atypical patterns of behaviors and activities. Maybe an example is repetitive behavior, difficulty with transition from one activity to another. They look for sameness and intense focus on details. And maybe some of these individuals have unusual reaction to sensation. So if you look at the spectrum of these symptoms, and the characteristics, you will feel something in common, and that is these children pose a great and considerable amount of challenge to the parents. And therefore, the first reason why we are focusing on parent mediated is over here. We need to develop some strategies. We need to develop these parents to learn some strategies for interacting with and managing the behavior of their children. The second justification for a parent mediated intervention comes from the heterogeneity of ASD. If you look at ASD, it is, I think all of you will agree with me if I say that there is considerable heterogeneity in the symptoms and in the characteristics and in the level of severity. At one end, you may find a person, an individual with a diagnosis of autism, living independently, carrying on with with considerable degree of normalcy with the relationship, with the professional and career-wise. Whereas in the other end of the spectrum, you may find the same another person with the same diagnosis of autism being very dependent and maybe requiring lifelong support and help from others. So this huge heterogeneity you will find. And therefore, we can say that there is no single and definite treatment plan for the diagnosis. I think I missed a point regarding the heterogeneity. It is not only in the symptoms and the severity, it is also in the background, the families from where autism is coming. It is found as a global phenomena. So a family may be, living in a developed country with lot of resource. Another family may be from a corner of Bangladesh, resource trained. So this heterogeneity in the symptoms, in the severity, and also in the background makes it very unique and very challenging. And thereby, no single and definite treatment plan for the diagnosis of autism is present or in hands with us, at least as of now. Therefore, it calls for a personalized approach. And who says that? The Lancet Commission, their report in 2022, the 64-page report, when we go through, we find that they are trying to say that it is not possible who requires what and when. So it is an evolving thing, and they are giving a model which is a stepped up model, and it is a personalized model of care for ASD. However, if you think of a personalized approach, it may sound good for a country where you have, or a community where there is resource. But for having any tailored approach, any tailored model of healthcare, it becomes very difficult when you are in a resource-trained country like us, or maybe where we are working, the IIRN, the Bangladesh or Sri Lanka, or all these Asian countries. So the Lancet Commission is proposing that start the approach of treatment or the approach of care for the ASD with the least resource intensive service. That is the first and the primary step which they are saying. And that is what struck us. And this is where, we thought that through the parents, we can take the first step of using the least resource intensive service. I'm sure all of you will agree that we don't require too much of resource for the parents to give an intervention. The third point is coming from the DSM-5 criteria for ASD, where it says that the autism has got persistent deficit in social communication and social interaction. Now, a child, before stepping into the society outside, is living in the family, which is the natural environment of the family, natural environment of a child, a growing child. And the parents are in this natural environment. Therefore, with keeping in mind all these 3 points, we thought that parents are the one who need to be, through them, we need to develop the intervention, and we aimed at developing a parent-mediated intervention to make parents more observant and responsive with their child. I'll just stop and ask all of you, are you all with me? Is it okay? You can.
Yes, ma'am. Yes, ma'am.
Okay. So next we proceed to the methods, how we developed it. Now, the method of development, we used a logic model to develop this intervention. I'm sure logic model, some of you are initiated to it. It is an organized visual roadmap to display our understanding of the context, the resource, and the outcomes that are required to develop this intervention and also to implement this particular intervention. So here is a pictorial diagram. Here you can see that a context means the environment within which the intervention will be working. So first, the requirement is to understand the characteristics of the context and the environment. After that, the next step will be to understand the input, plan the input. Input are nothing but the resources in the form of human resource, material, whatever resources or modules, training content, all these things will be put together and then goes to the next step, that is the activities. What process will be done to develop the outputs? That means maybe the modules, those are the outputs, or the training, the content of the training, or the screening, or the structured questionnaires with which we'll be measuring. So those will be the outputs. I'll go one by one. And finally, the outcomes. Outcomes are the measurable, changes which we'll be seeing or measuring at the end of the intervention. So the first thing, how we did it through some phases. The first phase was doing the context analysis. After that, we moved to phase 2. The phase 2 comprised of all these things: the input, activities, output, outcomes. Firstly, the planning, and then finalizing the intervention. And then we moved into phase 3, and phase 4 is yet to start. So I'll be talking about phase 1 first. So phase 1 is the context analysis. That is, the research team tried to define the characteristics of the environment within which this intervention will be working. So this was done through a thorough review of literature and engagement through meetings and interviews with stakeholders like the parents, educators, healthcare professionals working at the grassroots level, and ASD advocacy groups who are living in the community. What was the findings? Now, this is something, very interesting. The findings of the context analysis showed these few points. The first one was guilt and self-blame of parents. All the parents, I wouldn't say majority, all the parents in some form of other blamed themselves for the condition of the child. The blame, maybe, some people thought that it is a genetic blame, like it's because of me, or maybe the type of communication we ourselves are doing. So whatever was the cause, they felt that it is through them that this has happened. And some of the guilt and self-blame were all baseless also, like in the sense that it was all in the, the taboos and the stigmas they had in their mind regarding that, regarding the ASD diagnosis. Okay. The second findings we had context analysis was poor understanding of the ASD. This is very typical of, in the community where we had done this. It was mainly with the Bangladesh parents and eastern part of India, West Bengal. Many of them did not understand what it is. They did not understand why the child is behaving in a certain way. Couldn't make out things like why things are happening. Third is the geographical and logistical challenges that they are facing. Mainly in our country, what has happened, everything is urban centered. Most of the centers, the specialized centers for screening or diagnosis or treatment for autism, they are all, located in some urban pockets. So people had to travel long distance or go and stay overnight in some hotels and losing their job. So there were a lot of challenges they were facing, and they were already resource constrained. Limited availability of culturally appropriated support. Now, culturally appropriate support, with this I mean that in the centers, this is, through the interviews we could make out that the parents are not knowing about the therapies or what is happening. They know that there is a diagnosis, but they're not very sure what is happening, what type of therapy is happening, because those things were not not very clear to them. And last but not the least, the parenting style of this part, or maybe the whole of Asia as such, or India. The parenting style we found is having the main feature is collective expectation. Every child is as if modeled to be doing very good in their excellent in education, in school performance, the scoring, the marks, and going for a few particular, like becoming a doctor or an engineer. So the expectations were all similar, without paying any heed to the fact that every child is different, every individual is different, and every individual's attitude or love or passions are different. So this collective expectation in their parenting style was the one thing which is like counterproductive for a autistic child. So with all this context in our mind, we moved to the next phase. In phase 2, we planned through the logic model. So as I said, in the logic model, we had to plan for the input. So we planned for the trainers who will be training the parents, keeping in mind that the trainers should be believing in the naturalistic philosophy, that they believe that yes, parents are the best educators for the child. Parents give the best environment. The environment has to be conducive for the child's development. So those type of trainers, their philosophical mind bend, and they have to be specially trained for this. The training environment, whether it will be one-to-one basis or it will be at the home front or online, keeping in view that this all started during the COVID-19, the pandemic situations. The content material, whether it will be in the form of a pamphlet or it will be in the form of a PowerPoint presentation, or then financing. And finally, the organizational advisory groups, like having a scientific committee and ethical committee for getting all these things together. This was the input we had planned. So once the input was planned, we started the process. There were different activities which was under the process. One was development of social media presence that was required to recruit people for this. Then creating content for branding, development of content of training, identifying the outcomes, what we are going to measure to see whether this intervention is really working or not, and development of measures to assess the outcome, whether the children are really having some effect, whether their communication pattern is changing or social communication and interaction is improving or not. So we require to understand those measures. So we started developing these things under process. Next, we earmarked the outputs. So after the input were decided, the process was done. The outputs were the branding items for recruitment. That was social media flyers and posters, materials and modules for parents training. And third was assessment instruments to measure the outcomes. And after that, the outcomes which were decided, I've just put all the three of them. One was social communication and reciprocity of autistic children. We decided that we will be measuring this aspect only, and whether parental well-being is better or not, and satisfaction with the intervention. So this was the plan through the logic model when we developed. And based on this, we developed the intervention. We called it LIP, less instruction, parallel parenting intervention. Keep in mind the context analysis when we did, we found that instruction was one thing. The parenting style, I think I didn't mention that. Instruction was one thing going, the parents were using too much. Like they were being giving instruction to the child. And that was, for an autistic child, it was really counterproductive. All the time telling the child to do something was just counterproductive. So this was a part of the module. So we called our intervention LIP in short. So I'll show you the intervention under these 5 headings. First is target population. Our target population were parents of children who have difficulty in social communication, interaction, and reciprocation, may or may not have a confirmed ASD diagnosis. The recruitment of participants were done through social media posts, contact through community leaders, and snowball sampling was done by using one person was telling others, and then the third person tells another few more. We got sample participants in that way. The format was online group sessions between 15 to 20 parents. Both parents have to attend except for a single parent. And the format was in the form of presentation, discussion, demonstration, written demonstration through video sharing, feedback session through video observation. The duration was 2 hours per week for 5 consecutive weeks. The sessions I'll be showing you here. First was introductory session, which is not included in the 5 sessions, where general understanding about ASD, meaning of certain behavior of the child, talking with the support groups. The support groups comprised of other families, other parents who have navigated this type of situations, and now they have got some improvement in their life, so they have come as the support group. And then family management. Then the sessions included less instruction parenting strategies, strategies to enhance positive shared engagement through role playing and avoiding obsessive physical support. And the third session was on concept of parallel play and how to do it. And fourth is the promoting communication, understanding the development of social communication. This was one area where, when we did the pilot, we could understand one area where people are just not aware. They understand communication means talking without having any, understanding that the body language, the facial expressions, gestures, everything are different steps to the final, communication. So these things were something we could make them understand, and strategies how to enhance this. And maintaining, the final session was on maintaining joyfulness in relationship. So this was in the phase 2. After that, we did the phase 3 by validating the model, and this we did through a pilot study done among parents of 100 children. I'll be presenting about this pilot study only later. Phase 4 was monitoring of the intervention, which is yet to be started. And now about the pilot testing. Now the pilot testing, how we did was we recruited participants, and first we did a pre-intervention assessment of 2 things. One is parents reported sociability of the child and parent-child bonding. This parent-child bonding we saw with a video of 5 minutes of speech of any one of the parents, and it was uninterrupted speech which was taken before they started the intervention. And parents reported sociability of child. This is done through the ATEC scale. That is only one dimension. The sociability dimension was only taken into consideration. Then the intervention was given, and after the intervention, the same things were repeated in the post-intervention. So what did we find? We found that the parent-reported sociability score, there was improvement. Here, the lowering of the score means improvement of the condition, and a paired t-test showed a p-value of 0.02, which is significant. The effect size was very modest, 0.45, and this post-intervention data was collected within 48 hours of completing the intervention. Now, regarding the parent-child relationship, I've just put only 3 excerpts over here. I'll just read one narrative of one parent. The P7, that is parent 7, he said that he used to be in his, he means the child, he used to be in his own world, but now he has started participating with us in various activities. This is at the end of the end of the intervention. Participating with us in various activities without us telling him anything. Actually, not giving instruction is doing the change, the parent himself, and we could, we could identify that the area of change was in shared engagement. They were doing things together, the parents. All this while they were all separately doing things, but now they're together. Another said that Gloria has started responding to us. When we return home, he comes and greets us. It is so much happiness for us now. The warmth in the relationship started. All this while the parents were feeling like the child never greeted, the child never looked at the parents. It is not put over here in the slide. One parent had reported that first time I saw how beautiful are the eyes of my child. I've never seen, because the child never made a eye contact. So, the relationship was changing. So what we have here, the pilot testing of lip, what did we see finally? We can say in summary that the online delivery of lip is feasible, because it was. The parents were satisfied and the understanding of the intervention is good. However, the parents' compliance to the intervention was not 100%. This is something which we noted, like the better the compliance, like when something is taught to the parents, and when they follow it, they do it the way they are supposed to be doing, the children, their child was improving better. But where the compliance was not so good, then the outcomes was, I mean, it's quite natural and obvious. So it requires certain amount of deliberation on our part, and this is where we are now at this moment. We are trying to refine the lip to improve parents' compliance. So there are different strategies we thought, and our psychologists have found certain things, like putting them in some zones. Like after every session, they are given a feedback. The parents are given a feedback that you are in the green zone, you are in the orange zone, according to the compliance. So that it improves. And another strategy which is we are trying is telling them what exact changes, not exactly how much change, but which side you will be observing the changes, which aspect the changes. Maybe self initiative of the child, the social
Ma'am, sorry, you're muted. You're on mute.
I don't know how I got muted. When did I get mute?
Yeah, just before. Like now it's audible, ma'am. Now it's audible.
Okay. Okay, this deliberation part I had started, was it audible?
Yes, ma'am. Yes, ma'am. It's audible now.
Thank you. Okay, thank you so much. Okay, so these are the things regarding the compliance, improvement, and refining the lip to improve the parents' compliance. We are working upon it, and I think we require a lot of feedback on this also. Then improved feedback mechanism from parents. We are thinking of an app-based mechanism, to get the feedback from parents. At this moment, we are not having the mechanism of getting feedback from them is not very smooth. So that is another aspect we are looking into. And validation through input from stakeholders and experts. This is also, again, in front of you all are experts in this field. You can give, input about this. Moreover, we are trying to disseminate the findings of the pilot study. We are working with a group in UK, where I'll be going and presenting in front of an international audience to see what they say about it, and then refine the intervention in a better way. So in summary, I could say that the context analysis suggested that the first step for early intervention is parent-based intervention. And this is particularly true for a country like India, where we are resource crunch. So we used a logic framework to plan and develop a parent-mediated intervention. We named it, the intervention, as LIP intervention. When we did the pilot study, we got feedback from the pilot study, which gives us encouraging results. The next phase will be started after the completion of this validation process. And we at IIN, we are at this point of time. So feedback from the audience of today is very much welcome. These are some of the references that I have used, and thank you. These are my contacts and our organization, the research wing email address. You can send your feedback as well in this. Dr. Rajesh, I think I did it fast, right?
Yeah. Okay. It's exactly, we started at 7:30. So I think since Professor Richard sir has left, so I would request Dr. Jayanti Narayan madam to please take on the session.
Thank you, Rajesh. Lieutenant Colonel Dr. Lata Mandal, wonderful presentation. It
Thank
was
you, ma'am.
so clear, so precise, to the point, and the way, not just the content, but the way you disseminate it was also something all of us have to learn. Very nice.
Thank you.
There are a few hands up I am able to see. For questions, is it? Any of you would like to begin? There is one Surekha Meena. You have a question?
Dr. Jayanti, I didn't raise my hand. I must see, but can I ask a question, please?
Absolutely, absolutely.
Thank you. Dr. Lata, what were the interventions, or how did you get the parents to actually, because there's a lot of denial if you look at parents from, children who are on the spectrum, they're they're either they're either in complete denial, or even if they're aware, they actually do not want to acknowledge that their child has a problem. So I'm speaking mostly from the perspective of inclusion. And what are the interventions that you had for the parents, please? Because I'm trying to put something together where I can involve the parents a little more to help
Yes.
them understand their child and help them at home as well.
Yes. Okay. So this will thank you for the question. This is really, a big challenge. Yes. I will just go a little beyond this scope of this presentation by saying that, getting the parents is an ongoing challenge. We tried with few, like we have just we are just got acceptance for a case study where we first time tried out an adaptation model. See, I am from a nursing background, and we have the same thing. This is about autistic parents. I mean, parents of autistic child, but even when you get normal patients with a diagnosis, there's a lot of denial. They don't want to change themselves to a maybe a diabetes mellitus diagnosis, or a hypertension. You need to change the lifestyle where no acceptance. So there we use certain nursing theoretical framework. One is Roy's adaptation model. It's a middle range theory, very practical. You try to target certain what would you say, certain in the term of psychology it should be defense mechanism, but not so, like a self-respect of a person or a self-image of a person. So those we target those things and try to change the person. So similarly we have tried that also. What we are trying to first, the person, like these parents, basically they go into it's like a cascade. Most of them, they go into some of them go into depression, and mainly the conflict between each other, like both the parents blaming each other. So first, getting their priorities sorted out. I mean, not the first thing told to them is don't focus on the child, stop it for a while, put yourself on priority and get yourself sorted out. That sorting out takes time. I think most of it, the most helpful thing is from the support groups. We have the parents who are having children and with autism, and they have already navigated through these things, and they have felt that they are now successful. They are the ones who support these parents, tell them about their stories, their narratives help them. Certain situations when they face challenging situations, they talk with each other. I think that is one thing. Second is setting a routine for themselves first. It sounds very simple, but most difficult, I think, for all of us also. The parents are told to set a routine, to set, the house to be put in order, and give time to themselves first. So these are some way we try to streamline the parents into, try to align them with the child, because all this while just targeting the child is, I mean, that was a strategy. Now we stop that. And we also tell them to stop giving instruction to the child. So this is where the problem starts. We are so accustomed as a parents to keep giving instruction, do this, do that. So one very simple strategy our therapists and our psychologists do is tell them, just switch on your audio in the phone and keep it for 1 hour in the home, and you do your normal work, and at the end of 1 hour just hear how many times you have said no, don't do this, don't do this, like this. So sometimes people sometimes in an hour it is 200 times they've said no. So those things, you somehow tell them to make them to realize that what they are doing. So I don't know whether I'm able to answer you, because it's such a holistic thing that it is, and every person is different. Some of them require, the mothers require more counseling than the father. Sometimes the father stands with the mother. So it's all different and very personalized. But definitely it's a big challenge. And we are also facing this challenge, the compliance.
True.
They feel motivated, they stop after a while. They don't feel.
True.
And
True,
this is-
true. Yeah, because I have a lot of parents who are, either helicopter parents or gross negligence. They're on the either end of this, on a scale themselves. If you look at it that way, very
think
few
this
parents
is-
are balanced.
I think this is quite understandable because, see, we people are professionals in the field of disabilities by choice. We want to do this and we are doing this. No parent wanted to be doing an atypical parenting, having a child who is atypically developing. So it is quite natural that initially, I noticed that even on your screen, the first thing was guilt and shame that they were expressing. You see, so it is quite natural that parents have a denial mode initially and then try to look for a quick fix. Is there a medication that is going to give it and the child is going to be okay, kind of thing? Oh, you're going to put me through all of this, I have to do all of this. Then they start sulking and they have their own other things to do, other children to look after. So I totally see the challenge, and I'm also at the back of my mind seeing this justification to their behavior, the parental behavior, why they are the way they are. And all of us are definitely facing a huge challenge in getting the parents to comply with. And I'm glad you also mentioned, Dr. Lata Mandal, about the major point you mentioned about the parental compliance. You see, it's not 100%, and I'm able to see the reason. Now we have to find a way out for it. But it was, the question from CG is perfect, and your observations also, I think, are beautifully falling in place. But put ourselves in the shoe of the parent, and we are able to see, why they are the way they are, is how I look at it.
Definitely.
Yeah. But then that's not an answer to the question to be closed. We need to find a way to get them round, understanding them, and then get them round to accept the situation and work with us.
Yes,
True,
madam.
true. Because most of them are looking for quick fixes.
Yes. And that brings me to another point which we didn't mention in the presentation, that is about whether or not, this is a dilemma, whether or not focus on the behavior, disruptive behavior. Most of the parents, they want, you said, the quick fix solution to the behavior. So, and the moment you start focusing on the behavior of the child, they can be fixed to a certain extent, but then the whole focus of the parents shift to that only. So we have not measured it as an outcome deliberately. Let's not focus on it like that. So I don't know whether that strategy is really useful or not, but till now we have decided we'll not measure any disruptive. It's very easy to ask them how many times the child was throwing them. Has it reduced? It is reduced. We know they are reducing. They are saying that, but we were not focusing. We are not measuring. So I don't know. You will give me feedback whether it's a good strategy for us or not.
Yeah,
Anything
I
that
just wanted
works.
to say.
Go
Sorry,
ahead,
ma'am.
Rajesh.
I just wanted to say Mercy is our member, and she's from Dubai. She's working in Dubai International School, and she did her master's in special education, autism, and I happened to take some of her classes. So
Okay.
she's a very bright student. Thank you.
Oh, actually, Rajesh sir, it was because of Rajesh sir. All the credit goes to him because he's an awesome, excellent guide and mentor and lecturer
Absolutely.
who
I
guides students.
endorse it 100%.
True, true.
Yeah.
We have
2 more hands are up. Surekha Meena, are you there still? Or Deepika Garg? You have a question? or is it by mistake that the hands are raised? Anybody else? Anyone else who would like to have any questions or clarifications that you seek from Dr. Mandal?
Yeah, good evening.
I think okay.
Gee, go
Sorry,
ahead.
Jahir is from IIN. It's great. Jahir is here.
Good evening. Yeah, so it's an like it is a pleasure to have this on this platform. So it is a like I would like to add on to Lata ma'am's this hard work, that this is something is going to floor to bring out a protocol for practice. Actually, like there are so many protocols going haywire. Parents are misguided at times. They are not getting the right guidance at the right time. So this is what is in a low income setting or low and limited structure setting country like India. This is a model that is going to be like one of the like guidelines for practice in future. And this is I'm really very much like optimistic to have this accepted and like introduced in like UNICEF model. Okay, so UNICEF has certain models which has direct parent training and parent interactions for children in the spectrum. But this is a model which is customized for our setting, our own country. And this is the like another feather, and I'll extend my best wishes. Thank you, Lata ma'am.
And Jahir is in the team, and he is an excellent, like, he is also, you can tell about your work as well. He is also doing a lot of work, research activities as well as clinical.
It's not that platform. It's today you are the like host.
Okay.
Thank you so much. Thank you so much.
Anyone else? Any specific question? Anyone else?
Madam, I think if the participants would like to ask question in Hindi, they can ask. I think.
हाँ, हिंदी में पूछना है तो भी हिंदी में पूछिएगा, प्रॉब्लम नहीं है. जैसे मैडम बता रहे थे, कम्युनिकेशन इज इम्पोर्टेंट. कैसे भी प्रोसेस हो, कम्युनिकेशन होना चाहिए. हिंदी इज फाइन. I have a question meanwhile.
Yes, ma'am.
Dr. Mandal, just curiosity, not exactly I would call it a question. What I am struggling with, or the team with me, we are struggling with. See, currently there is a lot of work happening on caregiver burnout. So parents are now, even in national institutes like where I worked or where Rajesh is working right now, our model is parent empowerment. The whole model of the way we work is parent empowerment. Then for student B.Ed, D.Ed practicals and all, we have a lab school and other facilities and all. But then it is basically parent empowerment with working with the respective atypically developing child, whatever the ASD or CP or ID or whatever we call it. So parallelly, there is a lot of work now happening in general on how do we support the caregiver. Ultimately, it is loaded on the parents, that they have to be doing this. So this caregiver burnout is a serious situation that we are working on and try to help. And in Bangalore, Dr. Srinivasamurthy has come up with a lot of work, little booklets and everything. But he is focusing on terminally ill people's caregivers also alongside. And for us also, it is our parents as caregivers. And that is the reason I work with him, because he says the parents of children with disabilities also are caregivers who burn out, who have issues that they are unable to sort out, because they come to us, we say home-based instruction, ghar mein ye karo, wo karo. So the load is repeatedly coming back. So I'm just curious to know how you are handling that, because here we are focusing the parents as the mediators or the trainers. It comes back to them. They come out to us to seek help and we say, do this at home, So this is worrying. It is a issue that keeps bothering me. Have you found any focus on that?
Yes, now it's actually a very intriguing question. Having the caregiver's burden, which is which is, I think in my nursing career, I have seen too much of this
I know
caregiver
you would
situation
have.
like this.
Absolutely.
However, sometimes I feel in our country we focus too much on individuals. The onus of responsibility lies on the shoulder of the individual, and the support system from the, you know, from the society or the community is something which is less. Maybe because of that, the perception of the burnout or the perception of stress is more. So maybe that it is something, policy related. The support system is just not existing in our country. So yes, very much. We have actually never measured caregiver burden in this. Did we? We have II and other members as well. You can chip in. The Shubhashish is here. Tanmay is also here, I think. If you're there, just so Jahir, anything, we are not doing anything, we have not focused on the burden, although we acknowledge it, madam, of course. Really not. I think the first step is acknowledging and then measuring it, how much it is. Yes.
So is it possible that in your lip itself you have a pre and post test? The pre way of measuring what burden they were feeling after this process of your intervention, the post test, do they feel little relief? You know, some of your qualitative quotes that you had given was very heartwarming, you know, from the parents that they had given. So if there is a, though you are loading on the parents to do the home-based intervention or parent-mediated intervention, at the end of the day, when you do the post-test, do they feel their burden having reduced?
Yes,
because, you know?
Yes, madam. Yes, that is, yes, you're telling correctly. Like, they have expressed, many of them expresses what that they feel their family life is now more streamlined. They feel the conflict has, a lot of resolution of conflicts between the two parents. And like our psychologists, they have mostly they try to make these people to do some sort of meditation, some yoga, read books, or whatever is your passion, like focusing on themselves. And yes, it definitely reduces, if not caregivers burden that we have not measured, so I will not say, but so much of stress reduces, they feel much light. So yes, we can do that. We can. There is a scale called family management scale. I think one of the National Institute of Locomotor Disability, one master's student is doing a research on that. I think in that there is one aspect of that. That's very interesting. Thank you, ma'am. Thank you for pointing out. It's really nice.
It's an area of interest where we are all struggling to assist the parent. I wish I had a simpler way to help you, is the feeling we get when we talk to those parents. You see that how much can I do? You know, the stage they reach, it is sad, especially with those who are very dependent children with disabilities.
Yes, ma'am.
Anyone else?
Surekha.
Sureka Meena has again raised the hands, it shows. Anyone else? Any more questions or observations, appreciations?
Thank you, Dr. Lata, for this wonderful session. It was very informative, and it kind of, sometimes when you sit through certain sessions, they kind of jog your memory and also help you think and give you ideas on how you can go about, your way forward, kind of a thing. So thank you so much.
Thank you. I'll take another thing I want to share, because this platform is, so many of you are there who understand this. There is we had applied for a Cochrane review for, because the last Cochrane review on parent-mediated intervention was done in 2013. So it's a ripe time, for doing another systematic review on this. We got rejection. Shubhashish, me, and one more researcher, we had floated that the proposal for doing another systematic review based on 2013 review. It got rejection. Okay. So first of all, my question is, any one of you have any plans to do that? The rejection was based on this justification by the reviewer that parent-mediated interventions are no more useful. And it was something which really got us into that what that's trying to say. I think there was a that was totally clashing with the ideas which what we are trying to say. And they had proposed that you have to involve the stakeholders, which is like now in all autism research, or I think all researches, you have to get the stakeholders with co-designing. So we agreed with that. But anybody, madam, your stake at this, like why a review can be turned down on this?
That is surprising to me too, because that is, as I was telling, ask Rajesh and he'll endorse it. Our systems itself in our national institutes are through parents that we work, so that the reach out is much more. And when the parents are empowered, their dependence on us will reduce, because these are not conditions that is going to be cured with popping in the medicine or surgery, you see. So ultimately parents have to be empowered. And every stage of the child's development, right from the feeding bottle and diaper days to adolescence to adulthood, it is a challenge. Each developmental stage poses a different kind of challenge to the parent of a child who is atypically developing. Therefore, empowering them, they are the constants, may I say, with the child. They are the constants. They are the ones with the child most of the time. So I am quite surprised that this was a reason to
and this was something we felt, the divide between the West and the developed and the developing, because
our country, closely knit families we have, and parents take responsibility. Those country, it's the state's responsibility. Once the child is diagnosed as having a condition, they are on the state's funding for all their needs. Maybe that is a reason. I think we should not leave it at this. It should go on further, the study. Okay, they refuse. There are other channels, other.
Yes, ma'am. We are registering with the Prospero and
yeah, Prospero. Okay. Okay. Let us see. Even Scopus reviews, we can first do a review and then we come down to the actual our study also. The meta-analysis, I mean to say, of the existing studies. And then yes, this many studies have been done, this has been the finding, and this is valid. We have to first show that this is valid to do, then the prospective study that we have in hand.
Yes.
I'll be able to later, I'll take your email ID from Rajesh, and I'll be able to send you some other groups who are working on autism.
It will be nice.
And I've definitely I heard you saying you're going to UK. So staying in touch with Professor Richard Rose also might help you. He's from UK, basically.
Okay.
The one who introduced you, Professor Richard, our mentor.
Okay, I'll be in London for that one conference is there for this, a community-based conference. So, okay, that will be really nice to...
Maybe, I mean, it will be helpful to stay in touch. Today he has apologized and left. As you see the chat box, he has wished all of us Merry Christmas and a Happy New Year too. Yeah, he had to leave for another meeting. But yeah, staying in touch will definitely help. He is a big resource for all of us. We all learn a lot from him. Yeah. So that can be of assistance.
Yes.
Yeah. You have anything to say, Rajesh? Say, ask.
No, I'm in regular touch with Dr. Lata. So thank you, Dr. Lata, for taking out time and speaking in this forum. I just wanted to have just a few words. Like, can you tell about IIRN? What exactly is that?
Oh, yes. It would have been nice to have our psychologist. He has sent a message to me because he is not present, I think. He wanted to say that, one of the main strategies, actually, I am just doing the measurement part and analyzing. They are the ones who are doing work. He says, avoid blaming. This is something which that strategy which Madam Mercy was asking, blaming themselves. So stopping that blame thing, yeah, and simultaneously trying to develop the accountability and responsibility of the parents. So yes, you asked me to tell about IIN is Indian Institute of Neuropsychology Council. It's an NGO which is based, the people are all over, some of us are here in Kolkata, some of us are in some other parts of West Bengal, and some are from Mumbai. So there are people together. It mainly, during the COVID pandemic time, the people who have come together, they all faced this issue that you're not able to reach out to the children, reach out to the parents, and then the online platform started. So it is all the sessions are given through online, and mainly working with child development issues, um, autism to be more precise. And there's a huge population from Bangladesh who responds to that. They are actually, their availability of or access to any specialized treatment is just not existing. So in the Bangladesh, it is a lot of people who responds from Bangladesh. We have people from India, Nepal, Nigeria. There's a group of people from Nigeria, the parents from there. And it's so interesting to see study their background, what type of parenting styles. When you see their context analysis, you find it is worse than Bangladesh and India. So them and Sri Lanka, we had a group, another from Philippines. So all over, these Asian countries, and some also from Western countries, few, but there are. So mainly, and the what strikes you is the similarity or the commonality in the perception of the people. That is something very striking. So there's a lot of data. We are trying to work upon it and trying to make something meaningful. They're working very hard. Jahir works very, very hard, I know. I don't know whether Shubhashish is there. He was supposed to be, but if he's there, I could. Thank you.
Yeah, I saw him. But
I saw, but now I think he's left. He must be having a session or something. So
Indigen stands for indigenous, is it? What is indigen?
Indigen Institute. Yes.
Indigenous. You
Yes.
want? Okay. Okay. Good.
yeah,
Thank
he's
you.
there. Subhashish, Dr. Subhashish is there.
Is he?
Yes. Thank you so much for conducting this
Shubhashish
great
is a
and
psychologist.
nice presentation also.
Thank you.
You're all here from IIN, Dr. Lata, Jahir Abbas,
Mhm.
Dr. Tanmay Bose,
Let's see,
all
Tanmay.
get together here.
Wonderful work you're doing. This research is definitely a wonderful work and the right way to go, I feel.
Madam Jayanti, these people have been working very hard. I have, started the, working like what I felt for the first time when I interacted with them, this group of people. I felt they are doing magic. I really felt it. And then I thought, why you are not measuring the magic? You're just doing magic and you're not measuring. So they said, oh, why?
Absolutely.
And then we started. We need to understand how much. And what is another challenge we were discussing today only. We need to see the roadmap, like how effective it is after some time. What is the impact? We are seeing the short-term things. So maybe after 1 year, 2 years, because I remember one parent, I think Jahid, you were also there in that session. You remember one parent was telling, we don't know the roadmap. We don't know what's going to happen to my child at 16 years of age. Tell us that. And we didn't have an answer. So we are trying many things. We are trying to connect with other people who are working with autism so that autistic adults, madam, this is something which I think I can request you all. If you have, bring autistic individuals who are now in a position of, I won't say power, but in a responsible position, so that they become a role model. That will be something very encouraging for our children, not children, the parents.
Sure. If you want to be in touch with those parents and those who are working in and earning and having a
Yes.
proud of themselves, may I say.
Yes.
So if you want to be connected to them, a few that we know, we will share with you.
That will be really nice, isn't it, Shubhashish? Yes, that will be really nice.
We'll do that.
Well, good evening, all of you. Sometime back, I actually kind of got a dream, the similar, kind of request or want from a a principal in a school in Bangalore. She wanted to have a collection of data or information about people or persons with disabilities who are in a good position. So I was thinking about it and thought to create a Facebook kind of thing where people with disabilities only can be the can create an account, but others can only watch them, kind of thing that. But it's only a kind of dream. I don't know how much I can can further work upon it. And some of you may have more potential. Resources and people who have technology background can may think to carry upon this. Thank you.
You can, Satya, you can work with Dr. Mandal, pass on whoever, whatever details you have with you, whatever support you need from them to help you on this. Probably you should stay in touch. Satya works very hard. I know him, very committed to what he does. And now as he says, I don't know what next. You can probably hold hands with them for your mission also.
That will be wonderful. It's a good dream, actually, wonderful dream to connect these people.
I would like to add that there is Enable India, you know about that?
Yeah.
They also have a directory of people who are in a good positions right now. You can follow their page.
Yeah.
That will be really nice. It's such a vast country. We may be having many people. Just connecting
Yes.
together will be. Thank you.
Yeah. So thank you, Rajesh. Thank you, Dr. Mandal, for this wonderful presentation. And I'll be in touch with you. Whatever I can pass on to you, I will. And thank you all the participants who have been listening carefully and also learning, I'm sure. Passive learning, though you are not being so active asking questions or commenting, I'm sure there has been passive learning happening in all of you. And wish you all a Merry Christmas, holiday season, and a very, very, very Happy New Year to all of you. And thank you, Rajesh, for giving me this opportunity.
Thank you, and Happy New Year. And
so again, for meticulously organizing every single month. Rajesh's mother had been ill for a while. He was ill and hospitalized for a while. But he does not stop this last Friday of the month one and anything else that needs to be done. He manages to see that this IIRN activity happens. Amazing. Hats off to you, Rajesh. And get well soon. Coming years have to be healthy years for you. We are all looking up at you for more to happen in the field. You are the one who connect all of us, and you are doing wonderfully well. Very proud of you. And thank you so much.
Thank you.
So I take this opportunity to thank Madam Lata Mandal for giving us a wonderful session on effect of parent-based intervention among individuals with autism spectrum disorder. I also, on behalf of IIRN, would like to thank the mentors, Professor Richard Rose, Professor Emeritus of Inclusive Education, University of Northampton, Dr. Jayanti Narayan Madam, former Deputy Director of NIEPID, Secunderabad, Member Secretary, IIRN, Dr. Himanshu Das, Professor and Dean, SKD University, Rajasthan, and all the IIN members, team members who have joined here. For example, Zahir sir, Subhashish ji, and Tanmay ji. Thank you so much. I take this opportunity to thank Dr. Nitika Mendiratha, the CEO of SASR, who has given this platform, and we are using their office for our India Inclusion Research Network. Thank you so much. And I would like to thank Dr. Anamika ji, who is also our coordinator. Thank you, everybody who have joined for this program. Thank you so much. Wish you all a very happy and Merry Christmas and a very Happy New Year. And we'll meet again on January the 31st with another speaker on IIRN 3.6. Till then, bye-bye. Thank you.
Bye.
sir, thank you, sir. Happy New Year to you all.
Happy New Year.